Welcome back to the Concussion Teach Out. We're here at NeuroSport. I'm here with Jerry Freeman. He's the head athletic trainer at NeuroSport. Jerry, can you tell us a little bit about your role with treatment of concussion and here at NeuroSport?
Yeah, so as an athletic trainer here at NeuroSport, I work with our providers, our physicians that see our sports-related concussion patients. So that involves, my job involves helping our providers kind of determine what's like a safe amount of or number of exercises that someone should be doing in their recovery and stuff. And so that's what I'll bring them out here, and we'll usually get them warm up, and we're doing some sort of aerobic exercise is usually what we start with, and then the physician will come out and join us out here during the exertional session, and we'll just run them through things. We usually generally start with some aerobic stuff that's usually very limited on how much head movement that's involved with it, so it's relatively easier. And then we move to some of the vestibular stuff, which is like balance and some of their things that moving their head and twisting and turning type things. Once we do that, then we try and work in some changes of directions, changing of speed, some cuttings, stopping and starting, and then finally we progress them over to their sports-related activities, so some of the things that they'd be doing in their normal sport.
So it sounds like you're pretty involved in the care of people with concussions, really from the very beginning to the very end of their treatment here at NeuroSport. Yeah,
so the bonus thing, I guess, of being an athletic trainer is like usually we'll get to be on the sideline and we'll get to see the injury occur, and we'll get to see and assess that athlete, that individual, right when that happens, and then we're with them kind of through their whole progression while they're seeing their neurologist or their physician, their team physician, and then we do the things that we kind of guide them with their physician visits, and then we work with them on that and get them back out on the field eventually. So it's kind of a part of the whole process from start to finish.
Right, so you play a very important role. I think one of the traditional roles that we see athletic trainers and we see the people running out onto the football field during an athletic event is sort of that initial evaluation. So as an athletic trainer, when you go out there and you're first seeing and evaluating someone you're concerned about concussion, what are the kind of the signs and symptoms that you commonly witness?
So the most common things that I'll see on the sideline usually is headache and dizziness. Very, very common. The other thing is imbalance. People just have a hard time maintaining their balance and things. A couple other things that we notice is that the stadium light, like there'll be some light sensitivity or noise sensitivity where the stadium lights, they have a hard time looking at it, it makes their head hurt, or they can't even look at the scoreboard and because the lights from the scoreboard kind of bothers them. And then to a lesser extent, I'll see them have some sound sensitivity where the crowd or either the band noises and stuff bother them or irritate their head, doesn't make them feel right. But some other things that I'll see on the sideline as well is I'll sometimes see like mood changes where for some reason they're like really excessively happy, right. Or they're really excessively sad for no reason, and that'll take place on the sideline, and I can see it, their teammates can see it usually and stuff. But that's usually, those are all, I'm looking for like red flags, not to say like, oh, he has a concussion or she has a concussion, but more so, is it safe to put them back in? Are they safe to continue participating, or should we hold them out and monitor them longer? But those are probably some of the more common things that you'll see on a sideline, and some of the things that I'm looking for. Anything that'll tell me like, oh, sit back, think a little bit, let's hold on him a little bit, him and her, and let's reassess them again in a few minutes and see if they're progressing.
So after you've seen someone on the sideline, you feel like, okay, this person has a concussion, you're concerned enough. What's the next step? What do you do?
So if the decision's made, we're not putting this athlete back in. We'll finish the game, and then usually we'll reassess that athlete after the event is over. So we'll take them back into the athletic training office. We will reassess that athlete. If we're lucky enough to have a team physician with us covering that event, the team physician will assess them again at that time as well. And then we'll determine kind of the recovery. Do we need to go see like a neurologist? Will the team physician might want to see them, in his office or back in the athletic training office again next time? And usually the first few days is just this kind of, let's keep you out of as much activity as possible, especially things that are making your symptoms worse, and just monitor the situation. So for the first, like 42, 72 hours, maybe we're taking it easy. Maybe we're resting. If something bothers them, we'll keep them away from those things. Right. We're not trying to isolate them or anything like that, but definitely the things that are causing symptoms to be worse, we want to kind of keep them away for those first couple of days.
Right, I think that's a key thing for, especially in those initial days, is mostly resting, staying away from things that that make the symptoms worse is kind of important. Yeah. I wanted to go back to a point now. after you see someone on the sidelines for a concussion, does everyone go to the emergency room?
No, not everybody needs to go to the emergency room. Usually you'll have a discussion with if you have a team physician there on the sideline or whatever. If not, then sometimes if there's something serious that's sticking out to you, right, that you need to go to the emergency room for, and there's red flag things kind of that we have that we educate like the parents when we talk to them after the game, like, this is what we think is wrong. These are some of the things that we look for. These are the things to expect. But if they experience like some of these more severe things, then take them to the emergency room and see them. But not everybody needs to go to the emergency room if they think they've experienced a concussion.
Right. So those that don't need to go to the emergency room, which is probably most people.
Yeah.
What's the next step? What does an athletic trainer recommend?
So I'll recommend that they kind of rest and take it easy. So they don't have to like sit in a dark room or anything. And when I was growing up, you had a concussion and you were isolated, I guess, for like a week. And then that week, whatever that magical number was, for a week, you'd go back in, no matter how you felt really and stuff like that. And today it's really more symptom focused. So we're focusing on what the patient is experiencing and what they're exhibiting. And so we'll do a few days, like a day or two of rest. Then we'll look at it again, and then we'll start with some really, really light aerobic activity and see if they tolerate that. So in our clinic at NeuroSport, we like to use the exercise bike. Their head is kind of stationary. There's not a lot of other stimulus going on. You can just jump in and pedal. And then we see what their responses are. And if they're doing all right at a slow speed, we'll increase the intensity. If they're doing all right at increased intensity, maybe we'll do a little like really short, maybe 30-second like intervals where they're pushing really hard. And then we just monitor and see what their response is to those interventions and stuff. And if their response is good with those, then we'll progress them. If it's not, we'll hold them back. We'll have them maybe do that same activity again, except at a lower threshold that doesn't produce the symptoms again, and then we'll assess them again the next day. And usually as an athletic trainer, I get the advantage of being able to see, if I'm with a team, I will see that patient every day. I'll go in and work with that patient every day. So if you have an athlete that's injured, definitely involve your athletic trainer, because that athletic trainer can be with them every day and watch that athlete's progress every day as they get better.
Right, and when you're, as an athletic trainer, when do you recommend that they first see their physician after their injury, if they don't go to the emergency room?
Yeah, if they're not going to the emergency room, and most teams I'll have something, like a physician that I'll be associated with or that's associated with a team. Right. If they're not, they will have a pediatrician. Now, either way, if I pulled them out of a game because of a head injury, whether it usually hasn't been diagnosed, technically as a concussion yet, I'll need a doctor to see that. So whether that's the team physician or whether that's that individual's pediatrician, they will need to go see their doctor and have that injury assessed and stuff. And that doctor may or may say, we think you had a concussion, we think you didn't have a concussion, but the doctor will need to assess that. And usually, anytime after that initial injury, so they can, if they're there, they can see them that evening. The next day or two, I really like to see them have their physician start taking care of them. So one of the things we've noticed here is that we think if we start intervening with these athletes sooner, we've noticed that the sooner we can intervene with them, the quicker their recovery tends to be. And the ones that are difficult are those people that I'm going to take it easy for about 4 or 5 days, and 4 or 5 days maybe turns into a week or 10 days. And it's a week or 10 days before they see a physician. And by then, you've already set yourself back, and you could have probably been doing things in those days to help you progress along your path to full recovery and getting back on the field and stuff quicker. So I really like them to see a physician either after the event's done or the next day, within 1 or 2 days.
Yeah, I agree. So I think seeing people early and setting them on the right course, I think is really important to reduce potential long-term complications. Now, one of the things that I think you must encounter is when an athlete comes off the field and you're concerned you've seen something or someone else has seen something and you're interacting with them that they might not be truthful with you on the sideline. How often does that happen?
So athletes want to play. I mean, they want to get back in. And it doesn't matter whether they're getting paid to do it or they're at school and they're doing it for fun, if they're in a high school setting. And particularly if you happen to be, one of the starters or whatever, you want to get on. Athletes will always want to get on. Luckily, I've been in situations where my relationship with the coaching staff, my relationship with the athletes, and my relationship with the parents, it's one, full team that goes, that helps to make sure that these people are safe while they're participating in their sport and stuff. And ultimately, the athletes know they want to play, and a lot of athletes are savvy. They know the questions that you're going to ask. But they know the questions, they know what to say if they don't want to play anymore. They know what to say if they want to keep playing. And so it's not uncommon for an athlete to not be as truthful or maybe not mention some of the things that they're feeling at the time until a couple of days later. We get that all the time here in the clinic. Parents will come in and say, I didn't even know. We knew they got hit. He said he was fine after the game, but he didn't say anything about a headache or anything until maybe 2 or 3 days later and stuff. And so I don't usually go by what the athlete is telling me. They're going to tell me something, but I'm going to look at my evaluation and the suggestions that maybe their physician finds and stuff, and really determine their return and are they going to go back on based on some of the signs and symptoms they're exhibiting and their response to certain treatments, and not necessarily by what they're telling me.
And after you've made that decision that the athlete's not going back into the game, do you ever get a pushback or get yelled at by anybody, a coach, a parent,
I've been
other
fortunate.
players?
In the teams that I've been associated with, we've always had a really good relationship with the athlete, with the coaches, and hopefully I've been able to meet some of the parents at least, or before the season started, and so the parents understand where I come from. And I usually will give them what to expect. Like, this is what's going to happen if your child gets injured. This is what I'm going to do, and if I don't think it's safe for that for individual to keep participating, I won't send them back out. And so I have never got a pushback, especially from coaches. Usually with all my coaches, they walk up to me and it's just a can he go or can't he go, and it's just a yes no, and I don't get any pushback. I have never had a situation where I can remember where a coach is like, I really need this. I mean, I'm part of the team as well. I know who's important, I guess for the success of the team, and who isn't. And but I've been fortunate to be in good enough systems and programs where the coach would just talk to me and just tell me yes or no, and that was the final say and stuff. Occasionally, sometimes I'll get parents that sometimes say why is my kid not going back in or whatever. That's very, very rare, though, and sometimes you'll get that maybe if the recovery's been drawn out and they're wondering why they can't go back to practice yet, that type of thing. But I usually haven't had situations, where someone's putting pressure on me to put somebody in because of their, maybe their perceived value to the team.
Well, that's great to hear, because I think that means our message about concussion is getting out there to the athletes, coaches, and parents.
Yeah.
I wanted to get back to a little bit of something we were talking about before, because I thought, or at least in the past, people had said that when you have a concussion, you shouldn't be exercising. But you said that here at NeuroSport, when patients come in, we exercise them.
Yeah.
Okay, tell me a little bit about that.
So current research is suggesting that these athletes, and specifically athletes, very active individuals, the sooner they get back to their activity, the quicker they recover. And that's not just for their physical activity. If we're talking about a high school student, for instance, the sooner they can get back into their normal social life, the better their recovery is. The sooner they can get back to school, the better their recovery is. And the sooner they can get back to the team, the quicker their recovery goes. I mean, you can look at the stream where, if you have a little toddler and they have a favorite animal or whatever, and you take that from them, they're going to start screaming probably like that. So that's the extreme side of things, but just mature that toddler a few years or whatever, and think about if you have a hobby, something you love to do, and people you like to do it with, and you're doing this thing every day, and someone comes out and tells you, no, you can't participate in that anymore. Without having an injury, most people are going to be a little upset. Most people might have some anxiety. Most people might have some depression and stuff. And so getting these athletes back into their daily routines, whether it's school, whether it's socializing with their friends, or whether it's their athletic activities, they recover faster. Studies are starting to show us that those individuals recover much faster. And so that's why at NeuroSport, we like to get these patients as quick as possible. I had mentioned, see a doctor, within a day or two, because we can start interventions quicker that we believe can help these individuals get back to ultimately all the things that they want to do again in a quicker time frame than if we just isolated them and told them not to do anything at all.
Right, and so I think that's a great point. I mean, getting people back to what they like to do is really important. It'll reduce that anxiety from being removed from that. Now, You talked about the studies. Are there actually studies that show that exercise itself helps people get back to sport earlier than being inactive or not exercising?
Yes. So our own studies here at NeuroSport have shown that, and in addition, and we're not the only people that are researching this and studying this. Other papers have come out as well that have shown there are benefits and advantages to starting these activities in a supervised manner. Now, I'm not saying like let all these people do everything they're used to be doing as quick as possible. Studies show too little is not good. Too much is not good as well. Right. And so there's this fine line in between that, and this is the importance of seeing your physician early. There's this fine line in between of too much and too little, where you get the optimal recovery, and that needs to be managed by your physician. Your athletic trainer can work you through that and help you with the steps that they describe and suggest for you, but that should be managed by a physician and stuff. And so people that manage this, what we try and do here at NeuroSport is we find those limits, and so we can produce a plan for them to work with their athletic trainer or work with their individuals and their teams and work with their parents to do these supervised activities that gradually steps them back into their full participation.
Right, and I think that that definitely brings out the point of gradually getting back to things, doing things that if you're doing something and it causes a symptom, to back off from it,
yeah.
But doing things if they don't cause symptoms, to go ahead and do them. So that can be even sport-specific activity before you recover.
Yeah.
Jerry, thanks for joining us today.
My pleasure. Thanks for having me.